The Health Ministry and the Commerce Regional Council are currently discussing the possibility of decent accommodation for the Kalume family once the mother and her babies are discharged from the hospital. Minister Kalume Shangula made this announcement earlier today at the Windhoek Central Hospital's maternity ward.
The Ministry's contribution to the family will be as follows. The individual member of the Ministry of Health and Social Services are mobilizing funds to target 10,000 mark. This money will be deposited in the Lithium Foundation account to be used when required. We shall continue fundraising through NGOs. The Ministry will provide free medical care to the mother and babies until they attain self-sufficiency. The Ministry shall provide free psychosocial support services by social workers to the family, house visits by community health workers, as well as nursing outreach services.
Quintuplets are said to be very rare, with only 10 reported sets of 5 or more babies in 2018, according to the Center for Disease Control. Hilia Kalume is the first Namibian and one of a few in Africa. Dr. Farid, representing the Windhoek Central Hospital staff, expressed his gratitude to the team that successfully delivered the 2 girls and 3 boys.
I want to take this opportunity to appreciate the work done by the nursing staff, the medical staff, and everybody else who took part in making sure the care was up to scratch. And I want to say that the work is not finished. We have to make sure these little ones are very delicate. There's a lot of work to be done as yet, and let us make sure the work is done properly.
The babies are in a delicate state, says Dr. Zam. Therefore, great care is required. It is up to the specialist pediatrician at the Windhoek Central Hospital, Dr. Saara Shalongo, to ensure the quintuplets are cared for until the day they are discharged.
Oh, things are really happening here. Things are really happening here. And we as medical staff, we are really trying our best so that we keep these people alive. So we promise that we give all what we need to give to take care of these babies so that they get out of our hospital alive.
Hilia Kalume's employer, Trustco, also delivered some gifts and flowers. They're said to be having consultative meetings with the Ministry of Health and Social Services for Hilia to get a comprehensive maternity benefits package.
As a Trustconian, there is a long-term support plan in place for you and your family. And it's very, very important for the public to know we as Trustconians, we take care of our own. That is very, very important. That is part and parcel of who we are. It is our policy that those children, if they go through the proper training and care, they are first in line to be employed by Trustco 15 to 20 years from now.
Despite the presence of COVID-19 in the country, according to Minister Shangula, the Health Ministry continues to provide health services within its mandate. He says the continuous services pillar of the national COVID-19 response and preparedness is making tremendous strides in ensuring that normal activities as well as programs are ongoing.